to be with you as you start your service, and we're glad that you're participating in this webinar called Launching Your VISTA Service.
Oh, that is wonderful.
Filling in for Chris Hawks, my name is Khadija Carr.
And I am Andy King, and we're coming to you from VISTA headquarters in Washington, D.C. You will also see our colleagues, Kate Jordan and Eric Powell, in the chat and the Q&A to assist you.
Your microphone has been turned
today
on.
Are Kim Adams and Steve Gray from LSI. They'll be providing technical support. So now that you know a little bit about who we are and where we're located, we'd like to know where it is that you're serving. So we have an opportunity to use the annotation tool to get a better visual of where you're located. In a minute, you'll see the annotation tool appear on the left side of your screen. To use the annotation, first, select the square icon in the drawing tool pane on the left side of the slide. As you see it illustrated here, it's not live, that's just an image of it. So you click on the square to expand your shape options, and then you select the X or the check mark, which you see highlighted there. Then move your mouse to the location on the map where you're serving and click. Please don't drag on the screen, otherwise you'll cover up other marks that are on the screen. And if you're unable to use the annotation tool, for instance if you're viewing on a smartphone, please type your city and state in the chat panel. Now we're going to switch over to the live map, and the annotation tool is there. All right, and we see your X's coming in. Great, keep those coming. So did you know that we have AmeriCorps VISTA members serving in all 50 states, as well as in U.S. territories and tribal communities? With all the people attending this webinar, it's great to see where you're serving. Really are covering almost every state with just this group. And as you look at the map to see where others are located, remember that you can connect with each other through the VISTA campus in both the map and the discussion forums.
So now that you have a feel for where other VISTAs are serving, we want to go over the session outcomes for today. In this webinar, we will describe VISTA's mission in the VISTA program, review a few of
Your
VISTA's
microphone
recent
has been turned
accomplishments,
on.
identify people and resources that can support you, highlight action items needing your attention today and in the coming days, and of course we'll be administering the oath of service. Andy, ready to kick us off?
I sure am. So first, let's welcome you all to AmeriCorps VISTA. You're about to join a national movement with a very rich history. There are about 285 VISTA members beginning service with you today. And this year, more than 5,000 VISTA members are serving in rural and urban areas, in all 50 states, and in several territories and tribal nations. Volunteers in Service to America, or VISTA, has been supporting and at times leading the charge towards economic equity for more than 50 years. Our strength comes from the talent, motivation, and energy of our members, which soon will include you. So let me thank you for stepping up to share your skills and passion to serve our communities. It's truly an honor for me to welcome you on behalf of the VISTA program. I hope you feel the warmth and support from us and from your fellow VISTA members. Now let's take a look at a few milestones in VISTA's history that have led us all to this moment.
The VISTA program was born out of the civil rights movement and the war on poverty in the mid-1960s, and social equity and economic opportunity remains our mission. Our first volunteers were assigned in 1965 to Appalachia, Hartford, Connecticut, and the camps of migrant farm workers in California. President Lyndon Johnson, whom you can see in the photo, said to those VISTAs, "The initials of your organization spell VISTA. It is an appropriate name, for you will be opening up new vistas of hope for the poor, achievement for yourself, and greatness for your nation."
Fast forward about 30 years to 1993, and VISTA joins AmeriCorps, becoming part of a network of national service programs of the Corporation for National and Community Service, or CNCS. You may have heard of some of our grantees and partners. For example, Habitat for Humanity, City Year, Teach for America, as well as the Rockefeller Foundation and Service Year. That's in addition to the programs that CNCS manages directly.
Your
Most
microphone
notably,
has been turned
Senior
on.
Corps and AmeriCorps. And within AmeriCorps are AmeriCorps NCCC, AmeriCorps State and National, and of course, AmeriCorps VISTA. You're joining the ranks of over 220,000 VISTAs that have served. And VISTA alums have gone on to make significant contributions in other ways, such as serving in the U.S. Senate and House of Representatives, heading up a Chamber of Commerce, founding and leading nonprofit organizations, hosting a program on NPR, and even writing a series of books called Game of Thrones, just to name a few.
We know that the VISTA program is committed to economic equity, but if someone were to ask you what VISTA's mission is, how would you explain it? What really makes VISTA unique in the federal government? Well, let's start with this, which is our elevator pitch. The VISTA program strengthens organizations that alleviate poverty through the mobilization of volunteers and resources. And in addition to our mission, there are 4 principles that underpin the program. The first, ending poverty. Every VISTA project and every VISTA member aims to end or alleviate poverty one person, one family, or one block at a time. Second, empowering communities. In contrast to parachuting in and doing good things for people, VISTA members live among and involve community members in planning and carrying out the project. This is often facilitated by your sponsor, but strengthening and improving the community is our long-term goal through learning about values and beliefs and applying good community development principles. Third, creating sustainable solutions. Whatever you develop or create, whether it's a process, a system, or resources, you will develop them in such a way that people will be able to use them once you're gone. And finally, building capacity. All VISTA members aim to either increase the size of a project, increase the number of people served, improve the project's efficiency, or improve the project's impact on the community. That's how we measure capacity. Now let's spend a moment going over capacity building and what that looks like.
In the VISTA mission and program tutorial that you completed, you learned that your VISTA service should focus on building the capacity of your organization as opposed to performing direct service. This is a unique aspect of the VISTA program which sets it apart from all the other AmeriCorps programs. Quickly, capacity building in essence is about helping your organization to do more with what they have so they can serve more people or operate more efficiently. Direct service is about providing tangible assistance directly to those who need it. So to make sure that you understand and have a good feel for what we're talking about, we're going to play a quick round of this or that to explore the differences between capacity building and direct service. We're going to read a service activity aloud, and using your annotation tool, click to indicate with a small x whether you believe the activity is capacity building or direct service. Remember, don't drag the annotation tool, just click. And if you're on a smartphone or a tablet, you won't be able to use the annotation, so in that case, you can type your answer in the chat box. All right, so first up is
recruiting volunteers to build houses. Place your X to indicate whether you think it's capacity building or direct service. All right, so I'm seeing a few little dots on the capacity building side. Ooh, lots of dots now. It's looking pretty split, but still looking like most people are in capacity building.
Yeah.
All right, let's reveal the correct answer. And the correct response is capacity building, because you're not directly building the house. You are developing capacity by recruiting volunteers who will be able to do the construction work and engage with the organization in other ways.
All right, good job on the first one. How about delivering meals through a Meals on Wheels program? Would this be capacity building or direct service? And there the annotation tool is. Wow, overwhelming majority of you saying direct service. This is awesome. Same thing in the chat, direct service. A couple people in the capacity building realm. All right, so let's see what the correct answer is. Big reveal is direct service. Because in this example, you would actually be picking up food and delivering it to people. In contrast, if there were some related capacity building activities, they could perhaps be working to improve the Meals on Wheels program, say putting together policies and procedures, or maybe developing partnerships to help out with the food delivery. All right, good work.
All right, let's move on to the next one. How about teaching a financial literacy course to low-income individuals? You say capacity building or direct service? So it's looking like most people are saying direct service. Okay, I see one pretty large remark in the middle. Maybe they're on the fence. Let's see. All right, I think we've got enough responses to move on to the correct answer, which is direct service. Because this example involves hands-on educating individuals. Some capacity building activities that a VISTA would do would include things like developing the curriculum for the financial literacy course, connecting with organizations who can refer clients to take the course, or identifying financial literacy experts to advise the curriculum development.
All right, good work on that one, gang. Next, how about organizing a fundraiser? Capacity building or direct service? And wow, the early votes are looking very heavily in the capacity building, in fact, exclusively, perhaps unanimously, in the capacity building category. All right, a couple people saying direct service, a handful, half a dozen there. So the correct answer is capacity building. And the reason is because raising resources is actually building capacity, financial capacity. The money raised builds the resources of the organization so that it can do its work. Okay, we have one more.
All right, and that's setting up partnerships in the community. What are folks saying? Let's see.
Lots of capacity building. A couple people in the direct service realm. Oh, there's one, unfortunately, large star that's moving around and making it hard to see. But overwhelmingly in the chat, everyone's saying capacity building.
All right, so let's see that answer, and it's capacity building. Since you're striving to link the community with organizations, people, funds, and more to eliminate poverty and make a positive difference. So you're building capacity by helping community members find new ways to get things done and new partners to help them do it. You all did super great on this activity. Thanks so much for participating.
All right, so let's shift gears a bit and take a look at what you will be doing in your individual VISTA project and how it connects to the mission of the VISTA program. If you believe that we have a responsibility to bring an end to poverty, and if you're committed to working with communities, then you're in the right place.
We'd like to reflect for a moment on the key principles of the VISTA program. These 4 principles guide community development for us. Community work requires coordination and even collaboration, and working together towards long-range goals. As you think about these principles that we've been talking about, which one resonates with you? We'll now invite you to use the chat panel to share which of these principles resonates the most with you, and in a few words, say why. Maybe it's ending poverty. Before the session started, a lot of you said you joined VISTA because you wanted to help people move out of poverty. Or maybe it's empowering the community, a passion of yours through working with community stakeholders and identifying needs, and putting those needs into action with the help and support of the community. Perhaps capacity building is at the heart of who you are and what you do. Maybe you see a project and can identify a plan to increase its effectiveness and engage more individuals. Or maybe sustainability is something that drew you to the VISTA program. Maybe you have an eye for processes and developing them in such a way that they can be used once you're gone. So let's see, I see that empowering communities can help lead to all the rest. Sustainable communities, ending poverty. It's important to use power to empower others. Let's see, I'm seeing so much empowering communities, tons of capacity building, working together, and the importance of collaboration.
Yeah, Emily's talking about sustainability, as is Patricia.
I see a lot of folks saying that all of these are important and work with the other. Education, sustainability, building relationships. Awesome.
Yeah, this is great.
This is some really great answers, and I especially love these ones that say that all of them are interconnected. These are all really great responses. And it's important to know that all of these are important, right? And all of them are just as useful as the other. So hopefully as you look at what you'll be doing as a VISTA, you'll be able to pinpoint activities that touch on some or all of these key principles. Be able to talk about how to sustain the work you're doing by building capacity, empowering communities, and how these efforts contribute to ending poverty. So progress in this type of work can be very slow and incremental. So it's important to know that our work isn't just about fixing stuff, but it's also about sharing perspectives and skills as well. The results of your work as a VISTA member may not be apparent immediately, nor happen overnight. And at times that can be a little bit frustrating, but once you step back, you'll be able to see the larger changes that have resulted from your work.
All right, so let's focus now on what you'll be doing as a VISTA. And the best way to do that is by reviewing your VISTA assignment description, or your VAD. Each VISTA has a VISTA assignment description that was created by the VISTA project. You might have received your VAD during the interview and selection process, or perhaps your VISTA supervisor gave it to you today. If you don't yet have it, you can download it from your account in My AmeriCorps. All VADs include the following three elements: a project goal, several objectives, and then a number of member activities. The project goal is related to or is identical to the overall goal of the VISTA project. The objectives describe what you will achieve by the end of your service year. The objectives are a bridge between that overall project goal and your activities as a member. And finally, those member activities specify what it is that you will be doing this year. Those activities should add up to the objectives and the objectives to the goal. As I said, each of you has your own VAD, no matter how many of you may be serving or have served at the same project. Because the VAD is your work plan for the year, we strongly recommend that you focus on it with your supervisor over the next few weeks, and that you refer to it throughout your year of service. There's a worksheet that's part of your early service coursework in the Starting VISTA page of the campus. This VAD worksheet can help you tease apart the various elements of your VAD. It provides a nice framework for you and your supervisor to discuss your tasks step by step. So it's a good idea to download the worksheet and start filling it out so that you're well prepared to discuss your assignment description with your supervisor. If you don't already have a meeting set up with your supervisor, here's a good reason to schedule one. The VAD is a great place to start a conversation about your year of service. This is the week you should be introduced to your VISTA supervisor, to other VISTA members if there are any others on your project, as well as the staff and volunteers of the organization who you may be working with throughout your year.
We'd like to hear from you again. Based on what you know about your VAD, what will you be doing as a VISTA? What steps, tasks, or activities will you be doing to help eradicate poverty, build capacity in your community, and in your organization? Again, type your answer in the chat panel so that others can see. This can be a couple of words or a brief sentence if you'd like. Don't be shy. Let's get those responses in.
Well, there's lots of things coming in: improving access to healthcare, creating training, nonprofit community outreach, developing a community survey, workforce development programming. Wow, they're coming in so fast, it's hard to even read a single one. Wow, you guys are great. Expanding neighborhood outreach, building entrepreneur workshops, community mobilization, working with dropouts to get them back into high school, decreasing disparities, health disparities among different populations.
Wow, that's really a remarkable and widespread list of responses, and really is a testament to how much VISTA members are doing. So, as you get started in your VISTA service, you'll be focusing on a lot, right? And what it is that you'll be doing. So that really is a really wonderful time to mention the so what. What if you plan a community meeting, right? If you bring people together around a common issue, what's the next step and what's your goal?
So what if you write grant proposals? How will writing a grant proposal actually make a difference in your community?
So what if you recruit volunteers? Why specifically is it important to have other people assisting with the project?
And so what if you write a lesson plan? What purpose does this lesson plan achieve, and how will it impact others within the community?
So the big question we ask is, so what? And we ask because we want you to reflect on why. Think about this question in your service activities and when reviewing your VAD, as well as when talking with your supervisor. Take time to think about the reason behind your activities and the purpose of things you're doing. This will help create the intended impact of your VISTA service.
And the impact that you make this year depends largely on you. And it also depends on your community, your VISTA project, and a lot of times on good luck. So think about the so what when answering this next question. What impact do you hope to make as a VISTA member? And by impact, we mean what will be the end result, rather than what will your activities look like. So what will happen as a consequence of your success? Again, use the chat panel to the right of the slide. Think about this overarching goal as you go into your year of service. The work isn't always immediately satisfying, but it is important. Keeping the impact in mind will help you get through tough times when you feel that you may not be making a difference. Again, your responses are coming in fast and furious. You guys are great. Let's see. Community will have greater food security. Community members will be educated on drug use and prevention services.
Less opioid overdoses.
More third-grade children reading at the expected level.
Healthy lifestyles, more farmers, and education. More access for students.
Community residents will have greater savings and access to financial resources. Partnerships between tribal communities and a national wildlife refuge.
Financial literacy courses.
All right, great. So you've got the idea about impact and outcomes there. Keep your responses coming. These impact statements really are great to see, and hopefully keeping your intended outcomes front of mind will inspire you as you move through your VISTA year. And speaking of outcomes, let's take a look at some of the things that VISTA members have accomplished recently, so you'll have a sense of how your accomplishments can add up to the bigger picture. And these are just the measurables, not the intangibles, which are often the most interesting. In 2017, VISTAs have raised $206 million in cash and in-kind contributions for their sponsoring organizations. That's more than twice what Congress has given VISTA to run the entire program. Pretty amazing. VISTA has recruited, trained, and assigned some 800,000 community volunteers who collectively served more than 8 million hours. The National Center for Children in Poverty estimates 16 million children in the U.S., about 1 in 5, live below the poverty line. VISTA members made it possible for their sponsors to serve 3 million of those children in after-school programs, tutoring, and assistance in food security. Additionally, programs supported by VISTA members served 140,000 veterans and military families. And in a single year, about 8,500 VISTA members built the capacity of more than 4,500 nonprofits and public agencies. And about 70 of those VISTAs did so in their own hometown. Since 1965, more than 220,000 VISTAs have served. These are just some of the remarkable impacts that VISTA members like you have made, are making, and will make.
Wow, Andy. Before we move on, let's quickly review what we've covered, because we've covered so much. We looked briefly at how VISTAs relate to other national service programs. We then dove into the VISTA mission and its key principles and discussed how they relate to your VISTA assignment description, or VAD. And finally, we shared with you some of the impact VISTA members have had in the past year. Now let's shift to look at your rights and responsibilities as a VISTA member and some sources of ongoing support for you during your year of service. All right, so let's talk about some important issues that you've learned about in the Civil Rights and Responsibilities course on the VISTA campus. The VISTA program takes very seriously the issues of discrimination and harassment, so we want to make sure you're all aware of what your rights are as well as your responsibilities. As you learned, discrimination is when receiving treatment that is different because of a difference in sex, race, or any other protected class. Harassment is behavior that is severe or pervasive and creates an intimidating, hostile, or offensive environment. If you believe that you have experienced or witnessed discrimination or harassment, and if you feel safe and comfortable doing so, here are some steps you should take. Approach and talk directly to the person you suspect of engaging in harassing or discriminating behavior. If that does not work or you do not feel safe and comfortable doing so, you should talk to your VISTA supervisor. If you cannot go to your supervisor, or you do and the matter is not resolved to your satisfaction, you should contact your CNCS state office. Finally, you can contact the CNCS Equal Opportunity Program, or EOP. Rights go hand in hand with responsibilities. So while you have the right to serve to a service year experience that is free from harassment and discrimination, you also have the responsibility not to subject anyone to harassment or discrimination. So please be conscious of how your words and actions might be perceived by others, whether they're fellow VISTAs, staff at your site, or community members. And as a reminder, the contact information you see on the slide is included in the handout for this session, and you'll also be able to find it in the member handbook. AmeriCorps VISTA is a federal program, and like anything supported by taxpayer funds, we need to ensure that the program is well run and doing what it's supposed to, and of course, spending money wisely. Like all federal agencies, CNCS has an Inspector General whose office is responsible for preventing and detecting waste, fraud, and abuse. Most VISTA sponsors are familiar with the rules and do a good job of following them. But sometimes, things can get off track. There are a few red flags to be aware of. The first, if you are being asked to take over the work of a staff person, say someone who is out on extended leave, that is considered replacing staff and is not allowed. Or, if most of what you're doing is administrative support for someone else, that's not appropriate work for a VISTA member. You should be focusing on the things outlined in your VAD, which ties directly to the overall project plan that was approved by CNCS. And finally, the majority of your work should be capacity building, not direct service. From your coursework in today's activities, you now have a good idea how to distinguish the two, so be sure you're focusing on capacity building. If you feel like you're being asked to do things that are not appropriate for VISTA members, first talk about it with your VISTA supervisor. From there, you can talk with your CNCS state office. If the issue isn't resolved, or if you want to remain anonymous, please contact the CNCS Office of Inspector General. This is one of your responsibilities, to say something if you see something.
All right, and here is one more thing that you're responsible to do.
Your microphone
We
has been
mentioned
turned
last
on.
week that you will need to submit your fingerprints so we can run a background check. We do this, of course, to protect the community members and volunteers we work with, yourselves included. So let's talk about how to get fingerprinted. Your supervisor has your fingerprint kit that includes 2 fingerprint cards, a disclosure form, and a set of instructions. You should also be provided with a returned UPS label from your supervisor so you can ship your fingerprints to VISTA headquarters. You are responsible for getting fingerprinted and submitting your fingerprints to VISTA headquarters. You can go to a local police station, a sheriff's department, or other fingerprinting location, bringing those fingerprint cards with you. Your print must be submitted in ink on our cards. We cannot accept electronic submissions or a fingerprint report. We need the actual prints. Now, the VISTA program provides you with a $25 fingerprint subsidy. That'll be included in your first living allowance payment. You have 30 days to get fingerprinted, but please don't wait. Get it done as soon as possible. The deadline to submit your fingerprints is Thursday, February 21st. Failure to submit your fingerprints on time could result in separation from service, so please don't let that happen. If you find out your supervisor doesn't have the fingerprint kits or the shipping label, your supervisor should contact the CNCS state office immediately to get them. The other part of this process is comparing your background check results with what you disclosed on your AmeriCorps application. You might recall that when you applied, you were asked if you had ever been convicted of a crime. It's possible that you didn't disclose everything in that AmeriCorps application because perhaps you thought only to include recent arrests, or because you thought a DUI is a minor traffic violation, or because it happened when you were a minor and you think the record was expunged. If you fail to disclose any conviction in your AmeriCorps application, you will need to fill out the member disclosure form that's included with the fingerprint cards and send it in as instructed. When your FBI report comes back, we will compare the report to your disclosures both in the application and on that disclosure form. If everything's aligned, you won't hear from us. A minor offense with no relation to your assignment will generally not bar you from service. However, if there is a conviction that you have not disclosed to us, it could be grounds for dismissal, and we will have extensive follow-up. Now, on a lighter note, one of the greatest things about being part of AmeriCorps VISTA is showing off your VISTA pride. You never know where you may make a connection with someone who already knows about the program. So we invite you to put the AmeriCorps VISTA logo on your business card, in your email signature, on your organization's website and brochures. The more visible you are, the more support you get for your project and the AmeriCorps VISTA program as a whole. And that could mean more VISTA members and communities doing the work that needs to get done. The Helpful Links handout includes links to business card templates, publications and gear to use in your office and to represent VISTA in the field. And don't forget to take pictures and share them with us through our Twitter and Facebook accounts. We may share your story or retweet your photo. And in the next couple of weeks, you will receive an email with instructions on how to order your free, yes, I said free, VISTA polo shirt, lapel pin, tote bag,
I'm on the
t-shirt,
webinar.
water bottle, and journal within the next 2 weeks.
After you finish that, I'll see you in the morning.
Once your oath form has been submitted, and
Oh,
all forms
remember, I got about
completed,
4.
Okay,
stay
I'll see
tuned.
you after that.
Yeah.
Okay, all right.
Let's recap some of the many sources of support for VISTA members. You already know about My AmeriCorps and the VISTA campus. This graphic is a reminder of the list of resources that's on the starting VISTA page of the VISTA campus. And a direct link is available to download in the Helpful Links document in the Handouts panel. Whether it's questions about sick leave or healthcare benefits, pay schedule, or policy, this list points you in the right direction. For benefits questions, you can also contact the benefits administrator directly. And if you've exhausted all other options, you can contact the VISTA Member Support Unit, or VMSU, through the National Service Hotline. They are here to support you throughout your year of service. Now let's look at what's ahead for you as you get into your VISTA service. There are 7 elements of early service coursework that we ask all VISTAs to complete. They are self-directed and intended to help prepare you for success. First is a guide to help you make the most of your on-site orientation and training, which is a training provided by your sponsor or supervisor to prepare you for what you'll be doing at your site. The minute intro exercise helps you develop your elevator pitch, so you can clearly and succinctly explain to others who you are and what you're doing as a VISTA member. The resource on theories of change looks at various ideas about what causes poverty and theories on how to reduce or eliminate it. There's also a cool little video explaining how poverty is measured in the United States. There's also a worksheet to help you unpack your VAD and use it as a foundation for your work plan for the year. A tutorial on how to understand the community you're serving by looking at demographic data and research. And a video with Dr. Stephen Pimpere sharing 13 lessons about poverty that came out of the VISTA program. The worksheets and resources dovetail nicely with your on-site orientation and training and can provide structure for the first few meetings with your supervisor. We're not going to collect your worksheets. They are there for your own benefit, and we hope that you'll use them.
So there are a few key decisions and actions that you'll need to complete today and in the next couple of weeks. These first items relate to your VISTA benefits. First is your direct deposit. As we mentioned last week, your direct deposit details need to be absolutely correct in order for you to be paid on time. Any small mistake can result in a 2-week delay, so please double check the information in My AmeriCorps. Also, as we mentioned, your first living allowance pay date is February 8th, 2019. And be aware that if you're paid directly by your VISTA sponsor, your pay schedule may vary, so check with your supervisor about that. Second is your end of service award. You know there are 2 options, either the cash stipend or the education award. Be aware that if you choose the cash stipend, today is the last day that you can change your selection to the Ed Award. If you choose the Education Award, you have 10 months to change your mind. Third up is health care. You will be eligible for one of the benefits that VISTA offers, and which one you select depends on whether you already have health insurance. If you have insurance, you can enroll in the health care allowance, which reimburses your out-of-pocket costs. If you do not have insurance, then you can enroll in the health benefit plan. In about a week to 10 days, you will receive an email from IMG, they're the plan administrator. The email will have instructions on how to enroll. You can refer to the benefits section of the VISTA campus for more details on benefits. And there are a few other action items that you'll want to work on over the next couple of weeks. First is to set up a recurring meeting with your supervisor so you can discuss the VISTA project and your progress on a regular basis. Second is to complete the early service coursework that Khadijah just described. You'll find it on the Starting VISTA page of the VISTA campus. Be sure to download a copy of your VAD to help you complete both the OSAT worksheet and the VAD worksheet. Third, go out and get fingerprinted and submit a member disclosure form if you need to. And remember, those are due within 30 days. And fourth, order your VISTA gear. An email with instructions will come again in about a week to 10 days, so watch out for that.
Now let's discuss the oath of service. Before we start, we know that there are a lot of you on this webinar, and you may or may not already have the oath form printed. If you do not have a hard copy of the oath printed and in front of you, please do not leave to print it right now, because we have some very important instructions and we need everyone to pay attention. If you don't have a printed copy, you could use your cell phone to take a photo or screenshot of the next couple of slides, and afterwards use that information to print and complete your oath. The oath of service is an important step in your becoming a VISTA member. Because of the importance of this topic, we are pausing the chat at this time. We will be posting instructions in the chat regarding the oath, and we want to make sure everyone sees the information that we are sharing. Once we're done with the oath, we will open the chat back up to comments. If you have any questions at this time, you can type them into the Q&A panel, and our team will be sure to either answer them as soon as we can, or we will hold them for the end of the webinar. You're ready to take the oath of service. To do this, you need the AmeriCorps VISTA oath form, which your supervisor should have given you already. If you don't have it handy, later on you can download and print it from the handouts panel to the right of the slide. When you sign the oath form, you will need another person in the room to witness you signing it. I have a few instructions for filling out the form. These may seem obvious, but you'd be very surprised to see the things that people submit. Failure to submit a correct oath according to these instructions will result in a delay of your becoming a VISTA member, and it will also delay your receiving benefits. Please pay close attention to the information we display on the screen, as well as mentioned verbally. Please also note that an original ink signature is required on the oath, and a digital signature will not be accepted. So the form will need to be printed out and signed in ink by both you and the witness. But again, if you don't have the form printed out right now, please take note of the information that I'm sharing.
Your
and
microphone
you may want
has been
to take
turned
a
on.
picture of the screen. After the session, fill out your oath form, and we don't want you to miss any of the important instructions while you're trying to print the oath.
All right, so here are those specific instructions. At the top of the form in box
Your
1,
microphone has been turned
please
on.
print, in a really legible handwriting, print your full legal name. That's the name that you used in your AmeriCorps application, and so it's what is on file with us here at maya.americorps.gov. In box 2, write the name of the organization that is sponsoring your VISTA project, which is likely the organization where you are serving. Box 3, put the city and state where you are serving. In box 4, put today's date. That's January 22nd, 2019. That is your first day of service. And then in box 5, list the name of the CNCF official who is administering the oath, and that is going to be Khadijah Carr. You see her name spelled there on the screen, Khadija, Carr, C-A-R-R. It's critical that you fill out the form correctly, because if the name or information is not correct, it will not be accepted.
All right, so now let's that we've got that logistics out of the way, let's consider the oath that we're about to take, because you shouldn't take it lightly. This is the same oath taken by all federal employees up to and including the Vice President. The President's oath is a bit different. In the oath, it includes the phrase, to defend the Constitution of the United States. Defend. This is not a call to arms. For some, in some positions, it may be, but for most of us, defense of the Constitution may be just the opposite of using arms. The Constitution is not an administration, not even a flag. Rather, it embodies the principles that elevate us from a loosely organized group of on the North American continent to a civil society. We're pledging to defend the document that contains our civil rights. It also includes the phrase, against all enemies. Enemies. Let us all, as community builders, as change agents, and simply as individuals, choose our enemies carefully. Build bridges before you make enemies, and we all will profit. In the context of VISTA, of course, the enemy is what? Poverty. Okay, 2 more things about the oath. First, you may replace the word swear with the word affirm, if you so choose. You may also omit the phrase, so help me God, if you so choose. I want to recognize that since we're all in different locations around the country, scattered in so many sites in so many different locations, that we don't necessarily have the benefit of hearing each other's voices as we recite this. But it's pretty cool to know that as we're taking the oath, scores of your fellow Vistas are doing the same thing at the same time all across America. It may seem a little awkward to recite the oath aloud when you're alone in a room or only yourself and a witness, but really you're taking the oath for yourself. So do it for you and make it count. Now please raise your hand, your right hand, and recite the oath aloud along with me. I do solemnly swear that I will support and defend the Constitution of the United States against all enemies, foreign and domestic, that I will bear true faith and allegiance to the same, that I take this obligation freely without any mental reservation or purpose of evasion, and that I will well and faithfully discharge the duties of the office on which I am about to enter. So help me God.
All right, congratulations. You are now a VISTA member. So I want to welcome you in joining the newest group of AmeriCorps VISTA members. But before your status is actually official, in order for your living allowance and other benefits to begin, there are a few very important next steps. So we'll go over this in detail to make sure it's all clear. So you, the VISTA, sign and date the form on the line in the white area where it says AmeriCorps VISTA member signature. Put the date there next to it again, 1/22/2019. And then hand the form to your supervisor or whoever is there to witness your signature and have them sign and date it where it says witness. As a reminder, we cannot accept digital signatures. Only original ink signatures are allowed on this form. So once you and your witness have signed it, please scan a copy of the oath and save it to your computer as a PDF document. It doesn't work to take a photo of the form with the phone. We won't be able to accept that. So you need to scan it on your office's scanner so that it generates a PDF. And then attach the scanned PDF file to an email. And you're going to send that email to the VISTA Member Support Unit at the address that you can see on the screen. It's vmsu@cns.gov. And if you can't read what's on the screen, that email address is on the bottom of the form. And we want you to do this today, if at all possible. There's close to 300 of you on this, and we've got to get processing those oath forms right away. So please, as soon as we finish here, get it signed, scanned, and emailed off to the VISTA Member Support Unit vmsu@cns.gov. And then in that email, use the subject line and write the word oath, then your first and last name, and today's date, 1/22/2019. This detail may seem like it's not that important, but the subject line is critical because we get a large number of emails that come into the VMSU, and this helps us to sort and pull out everyone who's starting service today. If you don't, if you put some different subject line, it's going to take us longer to find your oath, so don't let that happen. All right, so to summarize these instructions, put today's date as the first day of service, 1/22/2019. List Khadijah Carr as the CNCS official. You sign it where it says AmeriCorps VISTA member signature, and then your witness signs just below your signature. And then you email a scanned copy in PDF format to the VMSU at vmsu@cns.gov. And in the subject line, put the word oath, your first and last name, and today's date. And please get that email sent today. Please note that when you email your oath form to the VMSU, you will not get a response confirming it, again, because there are so many of you. But the VMSU will contact you if they don't receive your oath, or if it's illegible, or if part of it is not filled out correctly.
Now that we've gotten you all sworn in, we want to know what you thought. How can we improve this presentation for future VISTA members? We really care about your feedback, and we want to hear what you thought. What worked for you? What didn't? We really do use this input and feedback to improve future webinars for VISTA members, so be sure to share your responses with us. Please take a few moments to complete a brief survey. Thanks again for sharing your feedback. So while you're contributing this feedback in the survey, we'll take the time to go through some of the questions that we've received throughout the presentation via phone and in the chat as well. So again, there are two ways to ask a question. The first is to post your questions in the Q&A pod, sending the question to presenters. And then the second is you may also ask a question verbally, and we'll invite our operator online to provide instructions on how to do so.
The floor mode is on. To request the floor, enter star, then pound.
Thanks, Khadijah. We've just started the floor request mode. If you've dialed into the webinar or had Adobe Connect call you back and you would like to ask questions on our phone line, please press star pound, and you'll be placed into the queue. When it's your turn to ask a question, you'll hear the prompt, you have the floor, and you can ask your question. Once again, to ask a question over the phone line, press star pound to be placed in the queue.
All right, so while we're waiting for questions to come in on the phone, there are a few that came in earlier. There are several questions about fingerprints, and one that bears mentioning for everyone. Haley asked, what if we've already gotten our fingerprints done, say for the organization where you're serving? Can I just send those in? Would that work? And the answer to that is no. We need to have our own set of fingerprints on our fingerprint cards submitted to us here at VISTA headquarters. And another one that was related, what do I do if the fingerprint kits haven't come in from the state office yet? Well, hopefully they should be there in a few days. Make sure with your supervisor that they have alerted the state office and that the state office has sent them, and it should only take a day or two for those to arrive. So you should have plenty of time to get fingerprinted before the deadline.
I see, since we're on the fingerprint topic, I do see a number of other questions related, and some folks are asking if they can do them electronically. So we don't accept electronic fingerprints. However, if the location you're going to will only do electronic prints, they will have to be printed onto the cards we provide. But we will not accept a digital scan of the prints. Let's see.
We have a question here about our health benefits that VISTA offers. And Rebecca said, I have public health coverage. So how does that fit into the options that you offer? So if you have any type of health coverage, whether it's private insurance or a public benefit like Medicare or Medicaid or VA benefits or tribal health coverage, any of those types of coverage that you have, you can then enroll in our healthcare allowance. So the healthcare allowance would then cover any out-of-pocket expenses that aren't covered by your other coverage or your insurance. If you don't have any coverage at all, no insurance, no coverage, then you can enroll in our health benefit plan, which we talked a little bit about last week. If you want more details, go to the VISTA campus, look at benefits, and the section there on healthcare will describe the two options in a lot more detail. So here's a question about transportation for commuting to and from our VISTA worksite. Ophelia asks, is that covered or is that something that we have to cover on our own? So getting to and from your home and to your site, that's your responsibility. Everybody has to get themselves to work. But if your VISTA service, if your VISTA assignment includes visiting other sites, like if you're driving around the county to visit with partner organizations, or you're setting up projects in different schools and you have to drive or travel somehow to those other sites, that is what we consider service-related transportation. And that can be reimbursed by your sponsoring organization. So if you have service-related transportation, talk to your supervisor. There's probably a form that your organization uses where you would track your mileage or track expenses if you're using public transit or some other mechanism. But your supervisor can give you the details on how to submit for reimbursement.
Let's see. Someone says, I was offered $100 a month towards rent as part of my compensation. How do I set that up? And do I need anything to make that happen? So it sounds like this is a very project-specific benefit and not one that the VISTA program offers to all members. So you should speak directly with your supervisor if they are offering or explaining any sort of housing or rent subsidy. All right, so it looks like we've got a caller on the line. We are ready to take them.
Yes, do it cover, do y'all cover the dental benefits as well?
Dental.
Sure. So you can, again, read more detail about dental coverage in the benefits section. So regardless of which benefit option you qualify for, either the healthcare allowance or the health benefit plan, we offer some limited dental benefits. So for instance, if you have a cavity, you can go and get a filling. You could get x-rays done and one cleaning during your service year. So there are some limits on how much expense can be covered, but it's primarily limited to routine services, those required for the treatment or alleviation of pain, those kinds of things. Optional services Cosmetic dentistry, orthodontics would not be included in that.
That was the only question I had.
Okay, great. Thanks for your question. And Kim, do we have another caller?
No, Andy, we do not. Thank you.
Okay, great.
Remember, if you wanted to call in and do a question, press *#, and we'll put you in the queue.
All right, so Jill asked if we can repeat the information about VISTA gear. It didn't come through clearly in the audio, so in about a week to 10 days, you will get an email from us, from the VISTA Member Support Unit, with instructions for how to order your VISTA gear. You have to use those instructions in order to get your free stuff. There's a polo shirt, a t-shirt, a water bottle, a journal, a tote bag, so some pretty cool stuff. Unfortunately, our ordering system is a little bit wonky, so you got to pay close attention to the instructions. But in a couple of weeks or so, you should get the email with those instructions, and hopefully then it'll be self-explanatory.
On our fingerprint, will you send is there a specific place we have to go to get fingerprinted?
So in terms of fingerprints, you can go to any law enforcement office, say a police station or a sheriff's office. Khadijah may be more familiar if there are other types of locations where you could go.
Yeah, there are also fingerprint-specific locations that aren't law enforcement offices, and there are a number of UPS or FedEx locations, depending on the area, that offer those services as well. So you'll want to check your unique location for that information.
How much would this cost?
I'm sorry?
What's the cost?
The cost of fingerprinting varies from state to state, but we do offer a $25 subsidy in your first living allowance to offset the cost of your fingerprinting. So some people might pay nothing at all, and some people might pay $10 per card. It really depends on the site that you go to.
Okay.
Thanks for your question.
Thank you.
All right, so Jackson had a question about, again, relating to health benefits. It says, will our benefits cover new glasses? So we do have a limited vision benefits in both the healthcare allowance and the health benefit plan. There is an allowance towards one new set of glasses or contacts, but it's, there's a limit on the dollar amount that you can spend. Other things are covered, like an eye exam, one per year. And then if there's some kind of emergency, if you have an injury or something, that of course can be covered as well. But the details are in the benefits section on the VISTA campus.
Andy, we have another caller in the queue.
Great. Go ahead, please, caller. Hello, are you there? All right, maybe not.
Hi there.
Oh, hi, go ahead.
There's just a lag. I was wondering if I enroll in the AmeriCorps health plan, am I still eligible for receiving reimbursements through the reimbursement plan, or is it an either-or situation?
It's an either-or. So if you enroll in the health benefit plan, your out-of-pocket costs would be very low, like $5 copay to see a doctor, or get a prescription filled. Generic prescriptions, there's $0 copay. So the out-of-pocket cost for the health benefit plan is very low.
Mm-hmm.
But you're right, you can only get one or the other.
Okay.
Currently do not have any more callers in the queue.
Okay, thank you, Kim. So there are a couple of questions in here asking about how the government shutdown might affect your ability to apply for public benefits, say housing or nutrition assistance. And unfortunately, we don't really have any inside information about the status of those programs. They're run by other agencies. So what you would want to do is contact either an information referral service in your community or a benefits bank if there's that type of organization in your community, and talk to a representative there. Or see if you can contact the local assistance office for your county or city, whether it's for supplemental nutrition assistance program, SNAP, or housing, or any other type of public benefit. So, different states and counties administer the programs differently. Some of them may have local funds that are available to supplement and to continue offering services. So I definitely hear the concern, and unfortunately we don't have any inside track on information about those benefits.
All right.
Oh yeah, so we're scrolling through the remaining questions here to see if there are any that are different from what we've already covered.
And remember, if you want to call in with a question, just enter *# and we'll put you in the queue and let you ask your question of Andy and Khadijah.
Here was another question relating to public benefits, asking, do I need to include my VISTA income when I'm applying for, say, subsidized housing? And so we talked about this a little bit last week. For public benefits, everything other than SNAP, your income as a VISTA member is disregarded in terms of determining your eligibility or the level of benefits. So in order to explain that with your application, you will go to your account in My AmeriCorps, and you won't see this today, but in a few days, once your account is activated in the system, you'll see this new option on the left menu. It'll say My Service Letters. And in there, you can print your service letter that explains that you are serving as a VISTA member. And then you can print another one that's called Income Disregard. And that explains the law behind this condition that says your living allowance should not be factored in. So you're going to want to submit all of that with your application for public benefits. So be aware if you're applying for SNAP, the income disregard doesn't apply, so your income will be counted in figuring out your SNAP benefits. So hopefully that helps.
Let's see. Can you repeat the two healthcare options?
Sure. So the two options are, we have healthcare allowance, which is for any VISTA member who already has health coverage. So if you have insurance or Medicare, Medicaid, VA benefits, any type of health coverage, you can then enroll in our healthcare allowance. The allowance will reimburse you for out-of-pocket expenses. So say you go to the doctor and you're required to pay $35 when you check in, you can get that receipt, submit it, and get your $35 back. There's actually another way that it works. you'll get a card. Once you get enrolled in the plan, you'll get a card for the healthcare allowance. And so when you go to check in for a doctor's visit or an x-ray or whatever, you would give your insurance card as the primary coverage and then your healthcare allowance card as secondary, so that anything that's not covered by your insurance would get paid by the allowance. And that way you don't have to front the money yourself and wait to get reimbursed. You can do that directly. So that's the healthcare allowance for VISTAs who already have health coverage. And that's going to be the vast majority of you. But if for some reason you don't have health coverage, you can enroll in the VISTA health benefit plan. It's it's a basic health plan. It covers routine kinds of services. You go to a doctor, you need a lab test or an x-ray, things like that. Those kinds of services are covered. Very low out-of-pocket expense. There are some limitations to be aware of, and too many to go into the details. But the biggest to know about is that it does not cover pre-existing conditions. So if you've got an ongoing medical condition and you enroll in the health benefit plan, just know that you couldn't get coverage for, say, doctor's visits. Say it's diabetes, and you need to go to the doctor, I don't know, every month or something. Those doctor visits would not be covered by our health benefit plan. However, your insulin and syringes would be covered. Prescriptions are covered regardless of pre-existing condition, but new services or doctor's visits are not. So if you're in the situation with pre-existing condition, the health benefit plan may not meet your needs. So hopefully that synopsis helps. And if you want more detail, again, go to the VISTA campus, check out the benefits hub, and go to the section on healthcare.
So it looks like we have time for about 2 more questions. I see one here that says, in regards to the state taxes, oh no, it's gone away. Will we be responsible for the payment ourselves? Are only federal taxes taken out? Forward to the question, but it has gone away.
Okay. Well, in terms of state taxes, you're right that in your living allowance payment, we will not withhold anything for state income tax. So you're going to want to figure out or estimate how much tax, your state tax, you're likely to owe at the end of the year. So you're starting at the beginning, of the year, so January. So you're pretty much going to serve as a VISTA for all of 2019. So you could estimate using the tax tables on your State Department of Taxation website, you could come up with an estimate of how much your taxes will be for 2019. You could divide it by 12 and put aside that much money every month so that come next tax season, you'll have the money to cover that tax payment. Now, in some states, as a VISTA member, your living allowance earnings will be lower than the minimum amount to even owe state tax. So double check and see what the situation is for your state.
I see a question about being sick or using any of your 10 sick days, and the question is, do I need to go to the doctor if I'm using a sick day? And the answer is no. There are some times where you have a migraine or some other less serious medical leave that you might want to take that doesn't require you to go to a doctor.
Yeah, but definitely you'll need to notify your supervisor that you're going to be out sick. And then, in some cases, if you're going to be out for more than one day, in some cases your supervisor may ask for documentation around that. All right, and Olivia was asking again about public benefits in terms of applying for Medicaid. And again, for Medicaid coverage, your living allowance should be disregarded. So make sure you print those letters and submit them with your Medicaid application.
Okay, this looks like it might be our last question for the day. Do you pay the state tax to the state you are a resident in or the state that your project is in? Andy?
So it would be where you earn the income. So if you're, say you're serving in Kansas, but you live across the river in Missouri, you would be liable. Well, let me think. That's a good question. I was thinking, you know, for regular employment, it would, because it would be withheld by the employer, it would be based on where you're working. Now I withdraw my statement and say I don't know. If that's a concern, you can contact the VISTA Member Support Unit, VMSU at cns.gov, and they'll be able to clarify that. So sorry I don't have that. That question has not come up on this webinar before.
It hasn't. Let's go ahead and wrap up the session. This is another quote from President Lyndon Johnson. On your idealism and on your success rests much of our hope for the final elimination of poverty in our American life. Thank you all for your participation and welcome to AmeriCorps VISTA. We wish you much success during your year of service. Thanks.
Congratulations and thanks everyone.